As coronavirus cases across the continent rise, much of our lives have had to adapt to living in the age of coronavirus. Lesiba Mothata, who's the head of strategic clients at Alexander Forbes, joins me on the line. Thanks so much for your time on SABC News this afternoon. Talk to us about, if you had to characterize how many parts of how we live will need to adapt, what would you say the overarching need is?
Yeah, you see, when COVID came, the world had to respond by regulation, which allowed people to now begin to work from home. So the biggest part that's going to be impacted is in how we produce economic value being at home. So the need under all of that, what underpins this whole thing, is going to be the use of technology. We have said before that data is the new oil, that we need data to do everything in the sense of telecommunication data, internet connectivity, devices to connect to the internet, without which there actually won't be any productivity that is assumed in the world as a result. And that's no different to Africa, where much need is needed around having data as the new oil to make sure that we can create new economic avenues.
Right, so what's needed for us to go from where we are now to ensuring that there is that connectivity that you've just spoken about?
What's needed now is to increase the infrastructure. So looking at data that comes out of the UN agency, what you see is that Africa has trailed behind in terms of having people using internet at home and having devices to do the same at home, because the infrastructure put together is insufficient relative to much of the world. But I took heart seeing that with COVID having come, all businesses, all governments, all regulators, and also telecommunication companies realize this fact, and they have expedited that supply of infrastructure. A consortium of telecos have come together to put an undersea cable throughout Africa. There are existing ones, but this one will prove to be far-reaching and much more advanced in technology, which is much needed to facilitate work from home in order to produce economic activity.
Mm-hmm. So when it comes to tech and innovation, especially using phone, there's a company, for example, in Nigeria called Welvis. They've created what's called a COVID-19 triage tool, which can help the person using the phone to assess what their risk is, and then depending on what they input into the system, it'll either take them to a doctor or it'll take them to a portal with more information. These type of interventions are obviously needed, but what about the reportedly 60% of Africans who live in rural areas across the continent and may not have access to this technology? What's going to happen to them now?
The digital divide is stark and burgeoning. And in here is an opportunity to have a response that flattens the curve, the digital curve in a way, because those rural communities need to be pulled into the economic activity. We don't actually have a choice now. The upside of this pandemic is that it's all very clear to all of us that we need to do that. We need to create a way to pull those people in. It has been done in the east of Africa. Look at the phone. The mobile phone has been used extensively to do mobile digital transfer of money, to do all sorts of things on a mobile phone. Well, that rests with the coverage of internet connectivity. Most has moved to 3G, and some has moved to 4G. But that coverage needs to cover the entire universe, specifically in the rural areas, and have mobility around it. But I think the COVID outcome emphasizes this very clear. It's clear that needs to happen. And what is happening in Africa is that both telecos and companies and regulators are working towards that to level the playing field and flatten that curve.
You know, Lesiba, we always focus on, especially when it comes to cell phone technology, the potential that Africa has to leapfrog, the potential that we have to skip over certain stages. At some point, it sometimes feels like people are just talking about the potential, but we never reach the actual climax or where we're supposed to be.
I know, so it feels like a cliche that we leapfrog, but you know what? It really is true. It changes lives, and much can be done. The East is a good case study. So the East has been able to make sure that much of society, it has a phone and they can do mobile money, which will prove to be unique in the world, not only in Africa. And that included all sectors, poor, rich, including farmers, who can do transactions, who can actually trade their maize on the futures market using phones in that way. While it sounds like a cliche, it is true that it changes lives, but COVID changes that uncertainty. It really brings everybody on the table and saying, we ought to change, we ought to make it happen now, and what has happened is capital is actually arriving. When I say capital, I mean there's investors that are seeing this as an opportunity in order to make sure that the case study you were talking about Nigeria can be much more expedited throughout Africa as we enter a new phase of this COVID. Because we'll need to do mass testing, we need to use data to help us, we need AI in a way to help us in this environment. Much of what has been seen in South Korea, you might say that Africa has a lot of catching up to do, but it leapfrogs. It does jumps a few steps. And I'm saying where we sit, it's an ample opportunity that, in fact, is increasingly becoming a consensus across all the economic sectors.
When it comes to medical tech interventions, they are needed probably now more than ever. What would we need to see in an African context in terms of medical interventions?
So we need to do the basics. So we need to do 101 on health, right? So the number of beds needs to be increased in terms of ICU, intensive care. We need the actual human resources to come through. The doctor and the nurse, the front line needs to be there. You'll see that response coming in South Africa, right? We've got Cuban doctors now in SA. That's to deal with the doctor and the nurse. We have seen also ICU beds being increased. You've seen a lot of people doing things using halls, using stadia, etc., to make sure that you increase the capacity of ICU treatment, notwithstanding the need for ventilators that continues to be there. So in health, we've got to do 101s, and in there might be opportunity to leapfrog, but in a pace that starts at the base. The leapfrog in terms of technology, I don't think we're ready yet to have this remote surgery that can happen elsewhere using AI, etc. It's needed with infrastructure on 5G, which we're not there, Internet of Things. But the 101 on health is what's needed. But think about it. That's an opportunity. We do the right thing. We save the human capital that's needed. Before you build a bridge, before you put out a telecom tower, you need a human to put that. So let's make sure that we do right. And if you look at much of Africa, it has proved to be a surprise to many when they look at the outcome of COVID. Say, why are the deaths so low? Why are the infection rates so low? People have opined on the reasons, including that less testing is taking place. But the outcome as we sit now is not as dire as people would have thought. Admittedly, the forecast going forward with all the scientists that are involved in this will paint varying degree of concern, and that's why one needs to be vigilant.
Lesiba Mothata, the head of strategic clients at Alexander Forbes, thanks so much for your time on SABC News this afternoon.